Hello guys, welcome to Medicaine.
So, next we'll learn about the patterns of fever. The first one is called continuous fever. As we know that the temperature range from 36.4 to 37.2 is known as the normal body temperature, and this zone right here, that is from 37.2 to 37.7, is known as the fever zone, and this is the baseline. So I'll tell you what happens in continuous fever. In continuous fever, the temperature raises above the normal body temperature and reaches the fever zone, but it never touches the baseline again. And the fluctuation is always less than 0.5 degrees Celsius. Continuous fever is seen in three cases, that is pneumonia, typhoid, and infective endocarditis. So, the next type of fever we are going to learn is remittent fever. So, we know this is the baseline. So, I'll tell you what happens in remittent fever. In remittent fever, usually the fluctuation is greater than 0.5 degrees Celsius and it doesn't touch the baseline as well. That is, once it enters the fever zone, it is raised above the fever zone, but it doesn't touch the baseline. So the graph of remittent fever is something like this. The third type of fever we are going to learn is intermittent fever. In intermittent fever, the temperature rises above the normal body temperature, but it also reaches the baseline again. So this is the graph of intermittent fever. It is usually seen in septicemia. The fourth type of fever we are going to be learning is called relapsing fever. Relapsing fever is a fever in which febrile episodes are separated by normal temperature. That is, you have normal temperature, suddenly you have fever, then again normal temperature, then again you have an episode of fever. This is called relapsing fever, and the duration should be more than 1 day. For example, relapsing fever is seen in Borrelia infection. There are different types of relapsing fever. Let's learn about the types of relapsing fevers. The first type is called tertian fever. As the name suggests, it occurs on first and the third day. It is seen in the infections of Plasmodium vivax, ovale, and falciparum. Now, I'll show you how the graph of a person suffering with tertian fever looks. So, let this be day 1, 2, 3, and 4. As I already told you, fever is present on the first day and it reappears on the third day. So, the graph is going to look like this. So, on the first day there is fever. And on the second day, the patient is completely normal, and on the third day, he has a peak of temperature and he has fever. And on the fourth day, he is again normal. So, the next type under relapsing fever is quartan fever. As the name suggests, it is present on first and the fourth day. It is usually seen in the infection of Plasmodium malariae. I'll show you how the graph of this looks. If this is the first, second, third and the fourth day, as I already told you, the fever is present on the first day and the fourth day. So, there is fever on the first day. On the second day, the body temperature comes back to normal. On the third day, it is normal again. And on the fourth day, it reappears. So, this is the graph of a person suffering from quartan fever. The third type of fever under the relapsing fever is known as Pell-Epstein fever. In this fever, there is fever for 3 to 10 days followed by a febrile period of about 3 to 10 days.
The next type of fever is called saddleback fever.
In saddleback fever, initially the fever lasts for about 2 to 3 days. Then there is remission, which stays or lasts for 2 to 3 days. Then the original fever reappears and it stays for about 2 to 3 days. It is usually seen in dengue fever. The next type of fever under the relapsing fever is the cyclic neutropenia. As the name suggests, it is cyclic and it is associated with neutropenia. And the cycle is about 21 days, that is, the fever reappears after every 21 days and it is associated with neutropenia. So, after the patterns of fever, I am going to be talking about an interesting type of fever that is known as the drug fever. As the name suggests, it is the fever which is caused due to the drugs. And the characteristic feature of this is, it is a prolonged type of fever. It can be of any pattern, as I mentioned above, and there is relative bradycardia, that is decrease in heart rate, and there is hypothermia. There is also pruritus, skin rashes, and it is also accompanied by arthralgia, that is the bone pains. The drug fever usually begins about 1 to 3 weeks after the drug intake and it persists for about 2 to 3 days even after the drug is withdrawn. And it may also be associated with eosinophilia, that is, increase in eosinophilic count. I'll tell you the drugs which will cause drug fever. So the drugs under this category are sulfonamide, penicillin, anti-TB drugs, methyl dopa, and anticonvulsants. An important thing to note: the drug fever is usually caused by altered drugs, and these are some of the special drugs. But digoxin is one of the drugs which does not cause drug fever. So let's talk about some of the special cases. So let's talk about fever which is associated with decreased heart rate, that is bradycardia. It is usually seen in many cases. I have a small mnemonic. You can remember it as BALD, that is BALD, and MTV. B is for brucellosis, A is a dummy, L is for leptospirosis, D is for drug-induced fever, as I already mentioned, M is for meningitis, T is for typhoid, and V is for viral fever. So, these are the cases where fever is associated with bradycardia. The next condition we are going to see is fever with rashes. So, the rashes are usually seen on the 1st, the 4th, and the 7th day. For this, you can remember it as chicken made tasty. So, C, chicken for chicken pox, M for measles, and T for typhoid fever. So, consider the situation. The body temperature is already 100 degree Fahrenheit and there is an increase in 1 degree Fahrenheit again. What happens? When this happens, there is an increase in pulse rate by 10. Respiratory rate increases by 4. The BMR of the body increases by 7 and O2 consumption increases by 13%. So you can remember it as 4, 7, 10 and 13. That is 3 in between. So respiratory rate increases by 4, PMR increases by 7, pulse rate increases by 10, and O2 consumption increases by 13%. Let's end the topic of fever by discussing about the treatment, which is one of the major things we need to know as medicos of fever. So, as we all know, there is an increase in temperature, so the first thing you can do is antipyretics. These antipyretics will decrease the hypothalamic thermoregulatory set point. I'll tell you what happens when you give antipyretics in viral or bacterial infections. When an antipyretic is given to a patient who is suffering from viral or bacterial infection, the antipyretic will relieve the symptoms, but it has no action on the infectious agent. Fever treatment in patients suffering from cardiac or pulmonary disorder is very important as it decreases the O2 demand. Aspirin, non-steroidal anti-inflammatory drugs, that is NSAIDs, and glucocorticoids are very effective antipyretics. So that's all about fever. If you like this video, share and subscribe to my channel and support me. Thank you.